Hey there, future nurses. Welcome to Guided by Night. I'm Dr. Knight, your DNP nurse educator and mentor. Now that we have successfully given our listener information about the situation, it's time that we move on and give our listener enough context so that they understand what is happening with our patients. This is the B in SBAR, background. Think of it as the patient's backstory. And most importantly, understand that you must deliver this information quickly, make it sharp, make it clear, make it relevant to the situation. Try to keep it under 20 seconds. The goal is to deliver the right communication to the listener so that we can get the correct intervention for our patients and keep them safe. Now, let's define what is background. Just remember that the background is explaining why the patient was admitted into the hospital and what is medically important right now for your patient. Also, remember that you're not telling the whole story. You want to filter the information so that you only give the provider or listener the things that they need. Just think that the patient's history can be full of many things, but you want to narrow it down. You don't want to list everything in the patient's medical record. It's just too much information. You want to focus and narrow this background down to 20 seconds so that you get straight to the point. And I'm going to show you how to do that with a few steps. Key elements to focus on in background. The first thing that you must focus on is delivering information regarding the patient's diagnosis and why they were admitted into the hospital in the first place. The next thing you're going to focus on is relevant history. And by that, I mean chronic illnesses like COPD, hypertension, any surgeries the patient had, and any allergies that you know of. The next thing will be current treatment. For example, medications, oxygen therapy, IV placements that the patient might have, and diet. And the last thing is pertinent labs or imaging that is relevant to the situation right now. These four areas are going to help you narrow the information that you need to give the provider. Now, I know it's going to take time. You're going to have to practice, but if you have a guide, it will help you to remain focused. Let me give you an example of a quick, sharp, relevant background. And I'm just going to read it to you, okay? Mr. Johnson was admitted yesterday with pneumonia. He has a history of COPD and hypertension. He's on 2 liters nasal cannula, IV antibiotics, and he was stable until an hour ago when his oxygen saturation started to drop. Now that is clear, straight, sharp, and to the point, under 20 seconds. Don't worry, guys. You're going to be able to do it. You're just going to have to practice. You're going to learn how to filter that information and deliver it to the provider so that your patient gets the right intervention at the right time. Think patient safety, and you're going to be successful at delivering SBAR. Now, I would like to give you an example of a weak and strong background. Let's start with the weak. Here's an example. He came in sick yesterday, has a lot of medical problems, and takes some medications. Now, guys, that is poor communication. It's not enough details to help your patient or help the provider to even think or manage what is going on with your patient. They cannot help you, the patient. They can't do anything. So you're going to have to dig a little bit deeper. So here's an example of a strong background. Admitted yesterday with pneumonia, history of COPD and hypertension. Currently on IV antibiotics and 2 liters oxygen. Narrow, straight to the point. Remember, guys, focus, relevant information. Don't worry, it's going to take time and practice. By the time you finish clinicals, you should be good at this and you're going to be ready to start as a graduate nurse. Just stay with me. Don't disappear. Now, I want to give you some tips as students, new graduates, and even some of the nurses practicing on the floor. You all need some help with SBAR. I remember when I was working as a nurse, no one even explained to me how to deliver a good SBAR. We pretty much had to figure it out ourselves, and trust me, we fumbled a lot. Some of us are still fumbling. But I'm going to give you some quick tips. The first thing is remember only to share relevant details. Cut the fluff out. You know, just it's too much information. You're going to overwhelm the listener or the provider. The next thing is think, what does the person need to know to understand the situation, and actually to start critically thinking so that they can provide the best interventions or recommendations to keep your patient safe. The last thing is jot down 3 bullets before giving a report. I know a lot of nurses don't like to do this, but if you start doing this, it will help you get organized in your thoughts. And over time, you won't have to jot down anything. You're going to know exactly what to say to the listener or the provider. Here's a challenge for you guys. I want you guys to please practice. Practice with your instructors, with your colleagues, preceptors, and your primary nurses at the bedside. Practice is going to help you get better with your delivery of SBAR. It's going to improve your communication. So always practice. Practice writing down brief, short backgrounds of your patient. Matter of fact, you have 2 areas now, situation and background. You got 30-second situation, 20-second background. Start practicing beginning now. The last thing here is background gives your listeners the context they need. So try to not overwhelm them, all right? It's really unnecessary. In our next episode, guys, we're going to focus on assessment. And this is where we're going to focus on delivering your findings to the listener so that you sound like a pro. Remember, clear communication saves lives, and SBAR is a nurse's superpower. Remember to subscribe, like, share to your colleagues, new graduates, and even some of the nurses practicing right now. Happy clinicals.